more pieces. Non-rebreather is a little bit more complicated. So the supplies you will need are the thin blue scavenging tube now. Okay. You also need the clear tubing that has a couple adapters on the end of it that just are permanently on there. A smaller reservoir bag for based on the size of your patient, and also this little corrugated tube. Okay. So we have to set the actual system up first, and that can be a little bit complicated. This green portion here is your pop-off valve, because remember when we set up a non-rebreathing system, we detach from everything at the top portion of the machine. So soda alignment up is not used with a non-rebreathing system. So this is why my pop-off valve is down here. When I'm setting things up, I know my reservoir bag goes closest to my pop-off valve, so it goes right on the end. And then just like up here where my pop-off valve was, this is where my scavenging hose attaches to. Same thing here, okay? Reservoir bag on the end, little adapter comes off the side. So that is where the first portion of my scavenging tube attaches to, okay? And then we have the other side. This thicker portion that kind of has that weird angled adapter on it is the one that goes into the corrugated tube. Okay, so small end plugs into place. So in the end of things, when you have a non-rebreathing system set up, that kind of looks like the pi symbol, right? So we have one going across the top and two going down the side, right? So then hooking it up to my actual anesthesia machine, my scavenging tube goes to the F-air canister. I still need this adapter that we need for a rebreathing system that we used prior, but I also need this little conical shape, or this more cone one, to go on top, because without this one, my tube gets shoved in, but this isn't a nice tight seal. I can still have waste anesthetic gas leak around it. So that's why we're gonna put the cone shaped one on top of that, and then I get a nice snug fit for my scavenging tube there. Okay. For here, I have to separate the top portion of my machine out. So where that occurs is on this side cord. Put this aside for 1 second. Now, there is, on the actual cord itself, a green piece of tape on top, and then also a green piece of tape on this adapter. You're gonna separate the two green portions. And all you have to do is grab the little top part here, give it a little twist, and then they come apart, okay? This part just hangs free to the room air. This one that comes directly out of your vaporizer is what you're going to attach your other clear end to, okay? Just like that. Now, leak testing this one is a little bit more complicated because, again, I don't have a pressure gauge to go off of. I'm just gonna put my F-air canister back down here. I still have to make a closed system, so I have to close my pop-off valve down here. So it'll tell you which direction to push it to close it, okay? And then this is the port that goes to my patient, so I'm still gonna plug that off with my thumb or the palm of my hand. Nice tight seal, okay? Still going to turn my flow meter up to 2 liters per minute. My bag is going to fill a little bit faster here because it's smaller in size, but I can't use my flush valve to pump this up faster because it just comes right out of here. So you have to wait for this to fill on its own, okay? Now, as it's filling, I want you to kind of feel it, all right? You want it to get like a firm pillow or like almost like a firm balloon, not to the point where it's going to pop. I've had students pop it before, but I'll hand this out so you can feel what I'm talking about. So I feel like it's pretty firm. I'm going to turn it down to 0.2 to keep that low flow going, okay? But y'all want to feel what I'm talking about? Okay, in terms of that firmness, okay? Anybody else want to feel my balloon? All right, now don't go past this because this is when it'll pop. Anybody else? Okay, so now that it's turned down, I'm also going to hold it up to my ear so I can listen for any hissing or something. I'm going to keep squeezing it to make sure that it's maintaining that tautness, because if I feel it get less firm, then I know I have a leak as well. But everything feels good here, so I'm going to turn off my flow meter, and then I'm going to open up my pop-off valve. Wrong way. Okay, and then still with my thumb on the end the whole time, squeeze out that extra air to the scavenging system. Right. So that is leak testing a non-rebreathing system. The last part I have to teach you is disconnecting from the big boy. Okay. This is where, if we had a student in the past, before my time here, break their nose. And it's, if you do it improperly, there's a risk of it. okay? So just, if you're not sure next term, come grab me, come grab Miss Ray, come grab somebody, and we can help you out with this, because I don't want y'all to get injured, okay? So after this has been flushed through, so we'll just kind of run some oxygen through it to get rid of any extra ISO in the tubes, we have to turn off the tank first. So remember, I turned it towards me to open it, so I'm going to turn it away from me to close it. I'm just going to turn until I can't anymore. That way I know the valve is completely shut, okay? But you see how my gauges up here still have my needles up? That means I still have pressure in my line. And the way that the student broke their nose is they tried to detach it before making sure these gauges were down at 0. So make sure that these are down before you disconnect. The way we do that, though, is, again, this has been flushed through, so we don't have to worry about extra ISO in the air. You're just going to hit your flush valve, push and hold. See my needles going down? Okay, I'm gonna wait till the hissing stops. So I'm pushing my flush valve now and there's no noise coming out, so I know that I've been fully depressurized. I'm gonna check both of my gauges. They're down at 0, so I know I am safe to disconnect now, okay? And the way we do that is there's a button on the front here of this green block. We're gonna push that forward and then pull my hose straight down. And disconnect. Are there any questions I can answer for you guys? That's it. Be safe. Oxygen tanks are scary, but you got it. All right, but that's it. So you guys are all good. We'll grab the other half and do the same thing. So.